just concluded the 9th International Conference, the aplastic anemia MDS International Foundation-sponsored conference. It's very successful, very tiring. I think we would agree. It's really an intense 2 days. And I myself was impressed by a number of things. One is that we covered a lot of different diseases that are related and in a lot of depth. Aplastic anemia, paroxysmal nocturnal hemoglobinuria, large granular lymphocytosis, myelodysplastic syndrome, constitutional marrow failure syndromes, even some leukemia. The second is that there was a range of really terrific talks, mainly by young people, maybe exclusively by young people, which was refreshing and educational for me, and I suspect also for Rich. And the subject matter ranged from very basic molecular and cellular biology to clinical trials, to drug mechanisms of disease, and to individual patient outcomes. I think for my own area of marrow failure, there's just, again, an amazing progress over the last couple of years, both in our understanding of the bases, immune and also in the hematopoietic stem cell of bone marrow failure, and a lot of progress in terms of treating patients. And I think it's kind of good when we have arguments about whether we can get a 90% response and long-term outcome in a patient with aplastic anemia with transplant versus a 90% outcome with medical therapy, and also looking for improvements in both medical and transplant procedures. So I'm happy. I think it was a great conference. We really owe a lot to the co-chairs who did the organizing and pulled it all together here at the meeting. So you should all look, if you haven't seen it, or re-look online at what people said.
I agree totally, Neal, thanks. I really was struck by the passing of the baton, as it were, to the younger generation. I think there's a great optimism in my heart and mind for what's going to happen with translational science in the coming years in the field of bone marrow failure and MDS. In particular, I was struck by the depth of the talks and the degree to which translational science was emphasized. In fact, there was even work in progress discussed, which is very exciting. You don't often see that in meetings where a lot of people come together. They usually just present their old data, but no, we heard new things in progress, particularly new trials that are directly translated from the lab. And I can't emphasize that enough. The work that the AAMDS International Foundation does in supporting basic and translational research that's going to benefit patients is fantastic, and we saw lots of examples of that today. We also touched on many of the controversies in our field, whether it's immunosuppression or stem cell transplant, what type of stem cell transplant for marrow failure, or whether it's the new classification system for MDS, which is confusing to many people. Some of that was clarified. Whether it's the right treatment for a patient who's going to have a transplant for MDS, what type of transplant they're going to have. So I think many important topics, as Neal mentioned, were covered. They're all dedicated toward improving the care of patients. They're all great science, and I hope people have a chance to listen to it if they haven't already, because they're going to learn a lot.